All right. Welcome back to Stopping the Who. This is Dave, along with my buddy James Roguski. We had some big news yesterday, James, and you're here to help us sort through it.
Yes, but I'm actually waiting for the bigger news, and I'll explain that. So yesterday, August 14th, the WHO had made a decision to declare what they call Mpox, which used to be called monkeypox, but the K is silent, so I call it moneypox, a public health emergency of international concern, or FAKE, PHEIC. And so what does that really mean to anybody? That remains to be seen, because going back 2 years, and one of my concerns is that when people go looking for information about this, oh boy, is everybody going to get confused, because they did this 2 years ago. I reported on this 2 years ago. 3 years ago, they had a tabletop simulation exercise, and almost to the day predicted an outbreak of monkeypox. And they did declare a public health emergency of international concern way back in 2022. And it ran for about a year. So when people go looking, doing a Google search, which nobody should do anymore, but if they go looking for information, they're going to find out that the public health emergency of international concern about Mpox ended in 2023.
Hmm.
Well, they're back, right? And it's been reinstituted. The emergency has been reinstituted. And so yesterday they made that announcement. They had a meeting of the emergency committee, and they advised Tedros Ghebreyesus, the Director General, that he should declare a public health emergency of international concern. And what does that mean? Okay.
Right.
Well, quite frankly, that's just the first step in the propaganda. Oh my God, everybody, be afraid.
Mhm.
Something's going on in the Democratic Republic of Congo in Africa, and some of the a few people in surrounding nations, seem to have a similar problem. Be afraid. Be very afraid. Uh, is your local government, are your local tyrants going to lose their mind and institute policies that have an impact on your life? Well, what remains to be seen is back in 2023, when they wound down the previous emergency declaration, Tedros did something that had never been done before in the history of the WHO. Is he gave standing recommendations to all of the many countries. That was back on August 21st of 2023, and they were to run for a year. So August 20th was the expiration date of those standing recommendations.
Hmm.
So he renewed those
Yeah.
for a year, and the emergency committee is supposedly working on um, temporary recommendations for the new fake.
Yeah.
And so it remains to be seen, what, if anything, they publish. And so in their announcement yesterday, they had, and I kid you not, they had an hour-long press conference, which I watched live and I recorded and I edited it, and I took out what I thought were the juicy bits, not from Tedros Ghebreyesus, but from their director for epidemic and pandemic response and all that, Maria van Kerkhove. And I got to admit, I watched the video 3 times, the entire press conference, and I fell asleep 3 times. My God, it was boring. Um, but hopefully, I've extracted some of the interesting pieces, and those all came from Maria van Kerkhove. And so, if you want to pull up the video, and
Yeah.
we'll hopefully not put people to sleep, I think this is actually kind of interesting.
Yeah. This is like a 4 minutes or so excerpt from the meeting. So let's see if it'll play here. I'm having okay, there we go.
There's a lot of uncertainty that we have we really need detailed studies. We really need to understand not only the transmission, but we also need to understand the natural history. We need to see the disease patterns. We need standardized data collection on the patients that are infected with mpox so that we could better understand the disease course, the severity of this, and most importantly, to make sure that not only are we focusing on prevention measures, but we're utilizing therapeutics and having therapeutic guidelines updated based on the evidence that we have. With regards to transmission, there's multiple modes of transmission that we really need to better understand. Primarily what we are seeing is the contact type transmission. We have seen sexual transmission, which is really what is concerning us. And now we have seen this virus, the different clades, and in particular clade 1B in sexual networks. And this is where we need to have targeted interventions, stronger surveillance, stronger contact tracing,
Oh, whoa, 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 whoa. I had to stop it there. Um, so they're talking about transmission, right? The type of transmission here and surveillance of that type of transmission. James, help me with this, brother. I mean, how are they going to surveil folks doing the thing? I don't
Well, I'll
I don't know how to really get too involved
there's
with them.
I'm glad you stopped it when you did, because the ideas and the thoughts start piling up. Okay. So, in the previous outbreaks, they claimed that upwards of 95% of the infections were in men who had sex with men. Okay.
Okay.
Um, I found on the New York City website, some of their recommendations for helping to prevent the spread. And some of those things were that people should be sure to clean their sex toys. Like, sounds like
Okay.
a good policy.
Now,
Um, but now this latest outbreak is in large part in children in the Democratic Republic of Congo. There are a lot of people who are refugees within the country because it's a bit of a war-torn area. And so what is really the cause of this? The thing that I heard in there, she's an epidemiologist, and they're like, well, wait a minute, they don't really know how this spreads because it doesn't fit with what they've been saying.
yeah.
And so they need more. I've never seen any scientific study that didn't come out and say, oh well, we need more study, we need more money, we need to understand what's going on here. Well, that does sound good, right? They need to comprehend and understand and get data and see what is really going on. And what are they going to do? Well, they want to open up these track and trace networks. Oh, this person is ill. Which hundred of their friends, do we need to track and trace?
Oh boy.
Go all the way back to the beginning of COVID. One of the other things that it triggered for me was, they're talking about it spreads on contact. Okay.
Yes. Yeah.
Well, I remember going to the grocery store back during COVID, and you couldn't get your shopping cart until the worker bee had sprayed, some kind of disinfectant on the shopping cart, to protect you from fomites. Okay.
Hmm. Hmm.
So what they say with mpox, moneypox, whatever you want to call it, um, is that the skin problems that it causes these watery pustules that then dry and get crusty, and
Hmm.
all the they say that the flakiness that comes off of people's skin is how you catch it. Okay.
Yeah.
Well, when you see what they're doing in Africa, to care for people, it's pretty difficult to care for another person
Hmm.
without coming into contact with them. So
Yeah.
they're all wearing rubber gloves.
Sure.
Okay.
Hmm.
Well, it doesn't do any good to wear rubber gloves just go back to the grocery store and you're checking someone out, and you're going through all of the products. You would need to change the rubber gloves between patients or between
Yes.
customers, right?
Yeah.
So
Right.
maybe wearing rubber gloves would stop something from getting into a cut if you had a cut on your hand, but it's all theater, just like the masks are.
Yeah.
If you're wearing rubber gloves, but you're touching this and you're touching that and you're touching the other thing, it doesn't make a damn bit of difference. And
Wow.
so I guess say what you want on this, and then we'll go back and see what else she had to say. There's a lot of juicy goodness in her short
Oh
comment.
yeah. Juicy good. I don't know if I would have characterized it that way, but so far It's been pretty juicy. All right, let's continue.
Stronger contact tracing, stronger risk communication, community engagement with affected communities, with CSOs, with people on the ground, so that we could limit that onward spread. We've said this before. You've heard DG say this. You've heard Mike say this many times. We can stop transmission of mpox with a concerted effort using multiple approaches in terms of looking at how the virus is transmitting in which populations. We do see transmission among families as well. We do see zoonotic transmission in addition to that. So these are the primary ways that we.
Okay.
All right.
I think there are an endless list of questions that we, the people, need to ask. Number one, she's assuming, as they always do, that the virus exists, and we're seeing it being transmitted on contact. Well, I know this is difficult to do, but there's this thing called Koch's postulates, where if you have a pathogen, his generalized test was you take that pathogen from someone who supposedly is ill, you isolate it, and you expose another person to it. So, I don't know who is brave or crazy enough to participate. Maybe they would do it with animals. Did you have, a test or an experiment or a study done where you scrape off, the dried
Flaky
scabby
skin, yeah.
flakies from
Yeah.
someone and give it to an animal and see that it causes the same problem? Okay.
Right.
I don't know of any evidence that that has ever been done. So the statement that they, see the transmission by contact, uh, wait just a minute. There's a lot of other things in the world that can cause those type of rashes, not the least of which is, one of the side effects listed in the COVID-19 jabs was that exact kind of skin problem. Okay. I've personally seen people who had a rash very similar to, what this looks like, and it was due to a liver dysfunction problem. They did a liver flush and the skin problems went away.
Yeah.
I'll give you an analogy, Dave. It's maybe a little bit of a stretch, but I think it's
Okay.
something people really should talk about. If you lived in a high-rise apartment building and you were locked into your apartment and you couldn't go out into the hallway and throw your trash down the trash chute into the dumpster down on the basement floor, at some point, if you're stuck living there, you're going to open up your windows and you're going to start throwing the garbage out the windows. Okay.
Right. Yeah.
Well, that's a decent analogy for how the body functions. If your liver and your kidneys and your sweat glands and all that sort of thing can't get rid of toxins by processing them and getting them to go out in your urine or through your digestive system, out your liver, through your gut, you're going to have skin problems. And, my question is, are what they seeing there, a vaccine reaction, multiple vaccines all piled together reaction? Is it exposure to some kind of agricultural chemical or some such thing? Is it generalized toxicity? Is it, ill health? Is it poor nutrition? Could be any one of a number of things other than a quote unquote virus. Then she went on to say, I think it was right where I stopped it, that they've seen new zoonotic transfer.
Right.
It's like, well, hold on a minute. Did you catch the monkey? Which monkey? Did you find a monkey with pox all over it, and the kids were playing with it, and the kids
Yeah.
got sick? Does it transmit to rodents like rats or mice or something like that? These types of claims should require some sort of evidence. So
Sure.
in
Yeah.
that short span of time that we've been listening so far, there's a lot of statements that are made as if they are true, and I'm like, you got any evidence to back up these claims that you're making? Because I don't believe you.
Right. Well, where are the receipts, right? Show us. You have pictures of that animal, that monkey, as you just described it. I mean, you could do a presentation and show people where you got this information and make it more rather than just make they're making these blanket statements like this happened and therefore, and so everybody has to panic. So let's, you want to continue with this?
Sure.
All right, let's keep going. Whoops, I think I went too far back. All right, let's see if I can pick this up right where we left off.
To better understand the use of the current PCR test, the other tests that
Oh,
exist that are
back
out
it up
there,
a little bit more.
zoonotic transmission.
There you
Okay,
go.
there's
Zoonotic
the
in addition to that. So these are the primary ways that we are seeing this virus spread. So we need strong surveillance and good diagnostics. Our diagnostics teams are working to better understand the use of the current PCR test, the other tests that exist that are out there to distinguish between clade 1, clade 2. And
So is she making the claim that we're going to use the PCR and then maybe are they suggesting they need to use a different test?
She is saying that her experts are still trying to figure out how to use the PCR. And so, we talked about over the past couple of weeks, a little bit more than a week ago, I published, PCRfraud.com. The PCR is not a diagnostic. The
Right.
PCR has been misused and fraudulently presented, for decades now. And she's actually saying that they're still trying to figure out how to use it to fake us out. Now, what are the criteria for diagnosing someone who has a rash? Well, if you look at what they did in 2022, they dug up stock photos and, they used stock photos from decades ago. And people have many different types of diagnosed ailments that result in some kind of skin problem. And it's one thing to say, oh, that looks like acne, or that looks like syphilis, or that
Right.
looks like, a bee sting or a mosquito bite, or,
Yeah.
that looks like some kind of um, dermatitis, right? Or whatever
Sure.
it may be. And so, yes, people have rashes. These things look very similar to smallpox. And there are people who have argued that it's really no different and that they just changed the name from smallpox to monkeypox to claim that they eradicated smallpox. Now, it's almost impossible to know because the people who are looking into this don't want to find the truth. They want to feed a narrative.
Fear. Yeah.
And part of the narrative is, using the same flawed, fraudulent diagnostic. And she'll go on to say some more about it. So let's keep going.
All right.
so there's some improvement that's needed certainly there. The other thing is, of course, access to these tests. We saw during COVID a lack of access, especially in low and middle income countries, and we're seeing that here as well. So part of the work that we are doing is not just trying to look at access to vaccines and therapeutics, but also access to diagnostics. So across the spectrum of having stronger surveillance, where we have surveillance, making sure that we have good contact tracing. So when we identify a case, we look at the exposures of others in the context so that we could prevent the onward spread, making sure that we have accurate, reliable, affordable diagnostics, and making sure that those are accessible in countries, working with manufacturers of diagnostics to make sure that those reach the countries in need. If there are requests for diagnostics from countries, that is something that we need to be aware of. We are aware of several, and we are looking at how we can get those those diagnostics into country. We need a much better understanding of the epidemiology.
Freudian slip there. Little Freudian slip there.
One of the things that the WHO and the pharmaceutical world learned during COVID was that they weren't big enough. They didn't have the manufacturing capacity to be able to scare the world all at once and to jab the world all at once.
Yeah.
And so what we dealt with in the United States and Europe and other developed country were case demics that were caused by testing everybody.
Yeah.
Okay. People tested, I don't know, papayas or, whatever else it might have been.
Yeah.
Pawpaw, I think it was pawpaw actually. And so if they had, infinite number of tests, PCR swabs to check people, they can create a pandemic anytime, anywhere, just based on the error rate of what the test is. If you've got a 1% error rate, and you test millions of people, you're going to find thousands of cases. I don't know how they're going to fake out an asymptomatic case of monkeypox. Okay. But, now what you're going to have are people who, every little pimple that they have, they're going to want to go get tested. Any little rash that they
Man,
might have, they're going to want to scrape off some flakies and go, send it off. Um, I guess we can continue and let her finish off, the
there might,
question.
yeah, there might be like a place, like a stadium or something you go to get the flakes tested. It's coming. I can see it happening.
In the affected countries, in the at-risk countries. We need to understand the transmission patterns. We need to understand the populations that are risked, and it's dynamic. There are multiple outbreaks that are happening. There are changes in terms of what we're seeing in the epidemiology itself. To understand that better will help us to use the limited numbers of vaccines that we have in a targeted and a most appropriate way. There's a
Can you stop
regional
it?
plan with
Yeah, they've got a solution before the problem even really develops.
Well, if you can back this one up again, I'll put my comment in, and then we'll play again a little bit further than that, maybe. Um, the transmission is changing, right? Well, they said it, and the parallels to the quote unquote AIDS crisis, decades ago, started out, in homosexual communities.
Mhm.
And what they're saying here from 2022 and the statistics that they brought to it were like 99% of all of the cases were in men who had sex with men. But now that's somehow shifting. And is what's shifting, the manner in which they are diagnosing it. Just let that run again, and I'll
All
stop
right.
talking.
All right. Let's play that again.
what we're seeing in the epidemiology itself. To understand that better will help us to use the limited numbers of vaccines that we have in a targeted and a most appropriate way. There's a regional plan with an initial ask of 15 million. So we were going to be looking at the regional plan. We're going to be looking at this multi-country outbreak and a response, working with all of our partners to come together with a consolidated ask. So that number will increase, but right now it's an initial 15 million, and we're asking countries, we're asking funders to come forward to support that implementation. The emergency committee is working on drafting some temporary recommendations for the consideration of the director general to issue. So that is something we expect to be able to release in the next day or two. The teams are working on it very hard, even as we speak, as we are sitting here. And so with those targeted temporary recommendations, there would be some advice for member states, affected member states, at-risk member states. I also want to highlight that the Director General extended the standing recommendations for MPOX for another year. He mentioned that at the press conference last week, and those are online. We could put that link in the chat. Last point is that vaccines are one intervention that can be utilized, but we do know that there's such strong country work, community work in terms of risk communication, community engagement for prevention activities. And we have seen with the global outbreak, though it was due to clade 2, and here we're really talking about clade 1b, there are a lot of interventions that could be utilized in country, in communities to prevent transmission.
So there's other things that can be done, apparently, James, other than we're gonna get another video here if I don't. All
Yeah.
right. Think I got out of it.
So, all of the things that the WHO does, if you have a good and kind heart and you listen to the things that they say, they always sound wonderful. And I'm sure, there are many people at the WHO who are just trying to do the best job that they possibly can. But it all gets twisted because of the financing. She said that they're looking for $15 million for their initial, ask, right?
Yeah.
Send us money, send the WHO money so they can go and help the world. And ultimately, it ends up being that these are money-making ventures, that these get, profiteered. Some company is going to be manufacturing tests. They have a drug called TPOXX. Sounds like something
Hmm.
from Klingon Empire.
Yeah.
Um, and that again, is not really properly tested. If I hear the word, safe, or the phrase safe and safe and effective used,
Yeah.
in anything to do with monkeypox, but talk about the perfect trigger for social distancing. Okay,
Yeah. Yeah.
If you're on an airplane flight and you're bumping elbows with the people who are, scrunched up in that sardine can next to you, and you notice that the person next to you has a little tiny rash on their forearm, um, people are going to be freaking out.
Right.
And so the starting point for all of this is for people to be aware that the WHO does not have any authority, period. They work on propaganda and psychological manipulation, hypnosis, if you will. I often call them the World Hypnosis Organization. The problem is going to be local tyrants. Now,
Right. Oh, yeah. Yeah.
it's interesting that they kind of did a head fake with bird flu. A lot of
Right.
people talking all about bird flu, and now this is what they declared. Um, I saw a report from the WHO this morning that, quite frankly, the numbers for cholera around the world, far go far beyond the numbers for monkeypox.
Right.
So they might run another one, and this is what I've been saying for the last 2.5 years. What they would like to do is have an isolated problem here and an isolated problem here. It's like whack-a-mole.
Right.
We got an outbreak here. There's an outbreak of polio in Gaza. They want to
Gee.
send polio vaccines to Gaza, as if those people haven't been,
True enough.
tortured and abused enough.
Right.
Let's go inject them or give them an oral polio virus, whatever. This is not something that's necessarily going to rise to the global COVID-19 worldwide pandemic problem. They
No.
want that fear out there, but this is going to be hotspot after hotspot after hotspot. They want to do testing. Oh, your local, animal shelter had an outbreak of, cat coronavirus. Everybody's got to get their cats jabbed,
Right.
and so forth and so on. So I caution and encourage people to realize that this might not be that they're trying to recreate COVID. People always fight the previous war. They say that about armies, that they prepare for the previous battle. This appears to be more likely to be, oh, look at what's going on over here. Be very afraid. Give us a bunch
Right.
of money. We're going to go do something crazy in that location, and everybody there will be very, very afraid, and their
Yeah.
local tyrants will do whatever they can get away with, and the companies that want to profit from that will focus their energies there. But then there'll be some, I don't know, Yellowstone, volcanic virus that, gets released. I'm just
Yellowstone.
making that up.
Yeah, I know.
Yeah.
Don't give them any ideas.
It'll be whatever, they feel they can get away with. If it's some kind of, avian bird flu,
Well,
they got to jab up all the chickens.
yeah.
Um, I saw another one the other day where on a dairy farm, they had all these large containers of milk that was, being milked from all the cows. And they're testing, on dairy farms, the milk to see if they can find a snippet of some genetic material using a fake test.
Very
The
sensitive
PCR is
test.
not. So it's all part of the overload.
Well,
And
let me ask you a question just before we wrap up.
uh,
What's the mortality rate with mpox, as they're calling it now?
um, it remains to be seen on how you want to look at the data. And they're claiming, 3, 4, 5%. They're saying it's all very, very deadly.
Really?
And so part of the problem with all of the data, um, how does anybody know if any of these numbers are real and true when the core diagnosis has to be called into question?
Yeah.
What was the mortality rate for COVID? Well, did you mean from or with, right?
Right.
Did people die from the treatment? What treatment, what are they doing for people with mpox?
Right.
Okay. Are they giving them information about how to strengthen and help their liver function
No.
so that
No.
toxins don't get spewed out through the skin?
No.
Um, the last place in the world I would ever want to be is in a clinic dedicated to, treating this type of ailment,
Yeah.
because until they actually identify what is truly, truly causing this problem, you can't fix it unless you treat the cause. And I have every suspicion in the world that the cause is not what they say it is. But they're not going to let us find out what's really causing these problems, because that would, open up a can of worms, open up Pandora's box for them.
Yeah.
What we all have to do is walk away from the industry that preys upon our lack of knowledge about how our own bodies function,
Yeah.
and
It's a good idea.
encourage people to pay attention. And so far, the comments have been great. The skepticism and the critical thinking, I think we need to strengthen. We all need to ask questions. When you watch that video that we just played, and you see how, I mean, they clearly say they don't know. They don't know how it's being transmitted. They don't know what to do for it. Their answer is, go get a jab that was, made for a different version. If you see the amateur nature of what they're doing, it should expose them even more. The more they open their mouth, the more they talk, the more they expose themselves. Let's help the world, understand how they try to run these games on us, and
Yeah.
the fact that it's, just a control of the mind. It's government trying to control you, turn you, into someone who's operating on fear. Last thing we need to be afraid of is monkeypox. We need to be far more afraid of our local officials who try to grab even more power and authority over us, using this type of thing as an excuse to, enact emergency powers and track and trace and surveil us, to control our lives even further. The answer's got to be no.
Yeah. James Roguski, always a pleasure to have you here. I'm sure that you and I are going to be discussing a lot more on this in the days ahead.
Encourage everybody to go to pcrfraud.com.
There you go.
And thanks again, Dave. Appreciate it.
All right.